Hello all, my name is Maya Strickland and today we're going to be talking about infertility, more specifically assisted reproductive technology. So let's talk about ART. Throughout this presentation, I will be using the acronym ART to refer to assisted reproductive technology. So what exactly is ART? ART is a group of fertility treatments categorized by the handling of both eggs and embryos. This means eggs are often removed from the ovaries and inseminated in a laboratory to then be implanted. How does this differ from other fertility treatments? Well, other common treatments handle only the sperm, used to inseminate while eggs remain in the body throughout the entire process. Today we're going to look at 5 different procedures and discuss why they are typically chosen. The first procedure we're going to look at is something you've probably heard before, in vitro fertilization, or IVF. The phrase in vitro is Latin for in glass, and it's used to describe this infertility treatment because insemination occurs literally in a glass laboratory dish, rather than inside of the body. Once this embryo is fertilized, it's monitored for the next 3 to 5 days to confirm that it is actively dividing. The embryo is then implanted directly into the womb. The second procedure we are going to discuss is gamete intrafallopian transfer, or GIFT. Unlike the previously mentioned IVF, GIFT does in fact occur inside of the body. It's a process where a sample of eggs and sperm are mixed and then deposited immediately into the fallopian tubes via a catheter. For some people, this seems to be ethically ambiguous, but we're going to discuss that in a bit. Right now, we're going to discuss the next procedure, zygote intrafallopian transfer, or ZIFT. ZIFT implements techniques from both IVF and GIFT to treat infertility. Much like IVF, the insemination of the egg occurs outside of the body in a laboratory dish. But unlike IVF, you do not have to wait 3 to 5 days for implantation. As a matter of fact, within 24 hours of fertilization, the embryo is then transferred directly to the fallopian tubes via a catheter, just like in GIFT. The next kind of assisted reproductive technology we're going to discuss is FET, or frozen embryo transfer. To do this, we use cryopreservation, a process that slowly freezes embryos to be used at a later date. FET takes these frozen embryos through the same procedure as IVF. The only difference is we're not using freshly fertilized eggs. In fact, FET is becoming more popular than IVF because it's proving to be more successful and effective. The last ART procedure that we're going to discuss is intracytoplasm sperm injection, or ICSI. ICSI is a process in which a single sperm is injected directly into an egg using a sharp and hollow needle. After the fertilization, the embryo is transferred directly into the womb, just as in IVF. So now you must be asking yourself, why are there so many different treatments that fall under the umbrella of assisted reproductive technology? The answer to that is because they're all logistically different, as are we. You see, IVF is commonly used to impregnate those with fallopian tubes that do not function properly. But for individuals with properly functioning fallopian tubes, good procedures might be GIFT or ZIFT. GIFT is seen as a more ethical alternative because the fact that sperm and egg can mingle a little bit more naturally. For those who do not find this to be an ethically murky area, ZIFT is a great alternative and in fact is a more successful procedure than GIFT. FET ensures the chance of pregnancy at a future date, and this can be really helpful for those who may be expecting upcoming fertility issues. And ICSI, as well as GIFT and ZIFT, can correct for difficulties that surround sperm count. Ultimately, the fertility treatments an individual or a couple decides to use depends on their overall needs.